This is Dr. Stephen Harkins. Welcome to page 56 of Anatomy Coloring Book, The Movers of Wrist and Hand Joints. More specifically, the extrinsic movers of the hand joints. In other words, the muscles that cross the wrist. They originate in the forearm and they cross over into the hand and help move the hand. Next lesson, page 57, will be about the intrinsic movers, the movers that originate in the hand and insert in the hand itself. Let's start with the superficial layer right here. It's these layers that originate, these three muscles that originate at the medial epicondyle of the humerus. The pronator teres we've already discussed in the elbow movers on page 55. Now we'll discuss the superficial layer of flexors of the wrist, starting with Flexor Carpi Ulnaris. A very descriptive name because it's a flexor of the wrist. In other words, it'll bring your wrist up like this, as this picture is showing. And it is on the ulnar side. So, and it attaches to the carpal bones of the wrist. Right down here, it inserts to the carpals. So it's a flexor. It inserts on the carpals, and it's on the ulnar side of the forearm. Flexor Carpi Ulnaris. And you can definitely feel this tendon in your wrist if you flex your wrist. You can feel this tendon, or if you make a fist, you can feel this tendon right here working on the ulnar side of the wrist. So it's a flexor, and it's on the ulnar side. Now I want to skip down to Flexor Carpi Radialis. Well, that's also very descriptive too. Originating here on the medial epicondyle of the humerus, and then traveling down and inserting on the radial side, on the carpals, but the radial side of the carpals. And this is the radius bone here, and this is the ulnar bone over here. So we have then Flexor Carpi Radialis and Flexor Carpi Ulnaris over here on the outside, and then right in the middle is, originating from the medial epicondyle of the humerus, is Palmaris longus. It's the longest of the tendons, inserting directly onto the palm, the front of the palm. So that is your first layer of flexors, the outermost layer, the superficial layer. The intermediate layer, we have this large muscle here called Flexor Digitorum Superficialis. Flexor Digitorum Superficialis. And here we had, let me mark Palmaris longus. Flexor Digitorum Superficialis, originating from the radius here, and from the ulna and the medial epicondyle as well. The insertion of the Flexor Digitorum Superficialis is these tendons here. You can feel these tendons on your palm and into your hand. It's the tendons of the fingers, and then inserting on the proximal phalanx of the hand of the last four digits. Here's the thumb, 1, 2, 3, 4, and 5. So the proximal phalanx here of 2, 3, 4, and 5. And of course, the job is going to be to flex or make a fist to flex these fingers. Now, if we were to cut away the Flexor Digitorum Superficialis, underneath we are going to find the Flexor Digitorum Profundus. Right here. Very similar looking muscle, although it does not originate here from the medial epicondyle. That's the superficialis. It originates from the ulna here and the interosseous membrane. And it too has long tendons all the way down to the second, third, fourth, and fifth digits. But it slides underneath. Look here. It slides in between the tendons of the Flexor Digitorum Superficialis, which was kind of split, as you can see, split here. It comes underneath into that tunnel, to insert all the way to the end, the final digit, the distal phalanges of digits 2, 3, 4, and 5. And that's Flexor Digitorum Profundus. I imagine profound means deep. And so Flexor Digitorum Profundus is and Superficialis for that matter, have very descriptive titles as well. They flex the digits, one's superficial in green here and one's deep, or profound, profundus. Lastly is the Flexor Pollicis Longus. This is the flexor of the thumb. Pollicis means thumb, and it's a long tendon, and it's going to flex it. That's B here, originating from the radius, and then traveling down all the way to the distal phalanx of the thumb. Pollicis, if you recall, in the study of the feet, means the big toe, and pollicis means the big finger. And here it is again, Flexor Pollicis Longus, with this long tendon all the way to the distal phalanx of the thumb. And of course, its job is to flex the thumb. Now, for the extensors of the hand and wrist, the extensors of the wrist do not bring the palm toward you, they push the palm away. This is the back of the wrist, extending right here. So, which muscles extend the wrist? Let's start by the superficial layer first with the Extensor Carpi Ulnaris. Once again, that's descriptive. It is the extensor that's going to extend the wrists. It's going to attach at the carpal bones, and it's going to be on the ulnar side. So where could we find that? Here it is. Extensor Carpi Ulnaris, originating here at the lateral epicondyle of the humerus, and then extending all the way down and attaching at the carpal bones of the wrist. Right down into here, the carpal bones on the ulnar side of the wrist. Next, Extensor Digiti Minimi. Extensor Digiti Minimi. Now, Digiti Minimi, what does that mean? It means a digit. It's one of the fingers. Minimi means small. The small little pinky finger. And you can see it goes all the way and inserts all the way to the distal phalange of the pinky, or the fifth digit. 5, 4, 3, 2, and then the thumb is number 1. The Extensor Digitorum muscle right here, also originating at the, where's Extensor Digitorum? Right here at the lateral epicondyle, or the, yes, the lateral epicondyle of the humerus. And let's mark the origin of the Extensor Digiti minimi first. And it, too, runs down the back of the forearm. And as its name says, Extensor Digitorum, it's going to extend the digits. And so you know it's going to insert, and it's got a little branch there to join the Extensor Digiti minimi. And it's going to go all the way out to the distal phalanges of digits 2, 3, 4, and a little bit to 5. Extensor Digitorum. Now, Extensor Carpi Radialis Longus. What do you think that's going to do? It's going to extend the carpals, or it's going to attach to the carpals on the radial side. It's going to be very long. Where is this one? Here we go. M. Extensor from the lateral epicondyle. This is the radial side here. This is the radial side over here. This is the ulnar side over here. And extending down right next to the brachialis muscle, or the brachioradialis muscle, and have a tendon all the way down into the carpal bones of the wrist underneath here. And that is going to extend the wrist. Extensor Carpi Radialis Longus. Then we have, right next to it, Extensor Carpi Radialis Brevis, right here. Extensor Carpi Radialis Brevis. So it also will, it will not originate from, oh, it does actually originate here from the lateral epicondyle of the humerus, and it will run all the way down to, and like I said, attached to the carpal underneath here, the carpals on the radial side of the wrist. Now, the deeper layer, once this whole group is removed, when they're cut away right here, you can see a deeper layer of extensors. They're smaller muscles, starting with Extensor Indices. What do you think it's going to do? It's going to extend the what finger? The index finger. And here it is right here. Extensor Indices. Going to, and attaching at the distal phalanx of the first digit. Digit 1, 2, excuse me, the second, 2, 3, 4, and 5. The index finger, Extensor Indices, makes sense to me. Now, Extensor Pollicis Longus. Well, I've told you that pollicis means thumb. What do we think it's going to do? It's going to originate along with the Extensor Indices on the ulna here, and travel down to the distal thumb. That's the distal phalanx of digit number 1, the thumb. Extensor Pollicis Longus. There's another one, Extensor Pollicis Brevis, right here. It's going to come and extend the thumb, but it's a shorter muscle. And it's not going to go all the way to the distal phalanx. It's going to attach at the proximal phalanx, and it's going to extend the thumb as well. And that's Extensor Pollicis Brevis. There's another look at the Extensor Pollicis Brevis right here. nice and short, just to the proximal phalanx. You see here the tendon of extensor pollicis longus. The muscle's hidden all the way to the distal phalanx. And then lastly, abductor pollicis longus. What is abduction? Abduction, A-B, abduction, is movement away from the midline. So it's going to bring your thumb outward, not necessarily up into extension, not back down into flexion, but outward, away from the midline of the body. You're in anatomical position, standing with your wrists facing forward. This is the muscle that will move your thumb away from the body. And so abductor pollicis longus. Abductor, of course. Pollicis meaning thumb, and it's long. Where is this? Right here. Abductor pollicis longus. You can see the tendon coming down and actually inserting at the base of the first metacarpal, right here. Here it is again. Right here, abductor pollicis longus, and then inserting at the base of the first metacarpal. So that's the lesson on page 56. The movers of the hand and wrist, the flexors and extensors of the wrist and hand that are extrinsic. Extrinsic meaning outside, not within the hand and wrist, but coming from the forearm into the hand and wrist. This is Dr. Stephen Harkins. Until next time.